Jan and Sally, very, very welcome to the Implementation Science podcast. This podcast has, for a very long time, I think, tried to understand how can we close this gap between research and practice. And when I learned about your project, and the more I learn about it, the more I'm impressed. It's called Jump, and I feel it really is a good example of how research teams, researchers, projects might close this gap. So, very welcome to the podcast.
Thank you.
Perhaps give a, because a lot of people won't know, just give a brief intro to who you are and what you do, and then maybe we can talk about what is Jump.
Great. Oh, do you want to go first, Jan?
Okay, yeah. So I'm Jan Burkhardt. I'm the former program director of the Jump program. Jump stands for Join Us, Move, Play, which gives you a little bit of idea of what it says on the tin. I'm now working in a role on knowledge mobilization to share the learning from the Jump program. And over to Sally.
So, hi everyone. I'm Sally Barber. I lead our physical activity research team at Born in Bradford, which is based at Bradford Institute of Health Research. And in terms of Jump, so I've been one of the research co-directors of Jump from the beginning, and I was involved in sort of the ideas generation stage right at the very beginning of Jump, and it was the person that put in our original bid. So I've been with the project from the very beginning, and still with the project many years on. So
yeah, so we're 7 years since the very inception.
Yes,
so
yeah.
More than half a decade.
Yes, and that gives, I think that gives an impression really of just how sort of what the scale of this thing, how long it's been going on for. It's not a small task to do what you've done. So what is Jump?
So Jump is a whole systems approach to tackling inactivity for children and families, focused on very disadvantaged areas. So our aim was to make a step change in the physical activity levels of children aged 5 to 14 in a defined area of Bradford that was very diverse, multi-ethnic area, and also very disadvantaged. The aim of that was to take a whole systems approach. I'll let a bit more about that in a minute. And that we were measuring to see if we can improve health and well-being, attainment in school, and create more safe, active, clean communities. So yeah, I'll hand over to Sally to say what this whole system thinking was behind it.
Great, thanks, Jan. So so I think going back to the very kind of beginning, taking us back to 2016, 2017, really, I think that's quite a good place to start when thinking about like what is Jump and how did we, how did this idea come about? So just taking us back to 2016, 2017, Sport England put out a call for places, localities across the country to take a system approach of and I think at the time, this sort of idea of what is whole systems, what is systems approaches was particularly in the field of physical activity was still very new. I mean, and it still is today, actually. There's not a lot of people out there who've done this kind of whole systems way of working in physical activity. So Sport England put out a call to kind of create a blueprint for working in a systems way or a whole systems way in localities. And over 100 places bid for doing this, and 12 were selected. So in Bradford, we were really fortunate that we were successful with securing the funding. The funding has been around £11 million from about 2018 to 2024. So that kind of like six years. And back at the very beginning, and like I say, this kind of whole systems approaches is really it's talked a lot about in public health and, like as a advocated for like great ways of working, but actually, when you actually look at the literature, it's very theoretical still, and not very many people have done it. And partly I think is because of that, like we've got these ideas from research and kind of ideas of how to do things, but practically it's really difficult to do, as we will talk about. And Jan's experiences can talk to that, I think. But so we kind of had this idea of, right, how do we create this whole systems approach to supporting children to be physically active? And just kind of a tiny bit of theory for you. So we decided over the years, we've kind of learned a lot more about systems thinking and the whole systems approaches. So the JUMP model is kind of based on complex adaptive systems thinking. It's based on the socio-ecological model, and it's based on Combi model of behavior change as well. So they're the kind of like three key kind of underpinning theoretical frameworks that we've used in JUMP. But that has a kind of thinking about it has developed over the years. So we didn't go into this in 2016 thinking, oh, we're going to use these three theories to underpin what we were doing. You know, it took us a while to work that through. But what we have is like a part of JUMP, which is around kind of understanding what's in the system. So what's the research evidence tell us about what works for children's physical activity? What do our local communities need? What do they want? What do they need? What do our partners see is important? And also kind of understanding this shift and the changes in the political, the social, and the economic system, because you know, with whole systems working, we can't be kind of like static, like things change all the time. So we have to be able to adapt to changing circumstances. Then, yeah.
Yeah, so really then the interesting thing that happened was that the JUMP proposal that was put in back in 2018 was for a research institute to lead the work, which was the only one out of the 12 local delivery pilots that was successful. Obviously, the cohort study, the Born in Bradford cohort study, was probably a really big draw. So it's an interesting thought that in terms of research and practice, the fact that there was a great research kind of potential was one of the reasons I think Bradford was successful in bringing 11 million passengers, a significant chunk of money in a time of austerity to the district. Yeah, it was basically, I came in from a background in public health as very much a doer. So I've been very much implementing child obesity and physical activity programs, commissioning them, delivering stuff. And then we were in a research institute, and we were sort of basically putting together our research team and our doers, our implementation team alongside each other. And some of that came about for actually really unplanned. Do you want to say a bit about the issue about when we were successful and the governance issues with Active Bradford and the fact that it had to come to the trust and stuff?
Yeah, so when the bid went in, it was a consortium bid between Active Bradford at the time was a company limited by guarantee that was sort of taking leadership in physical activity across the Bradford district. And our partners were local authorities, so Bradford District Council, Bradford Teaching Hospitals Foundation Trust, Bradford University, Bradford College, Bradford Bulls, Bradford Football Club, so Yorkshire Sport Foundation. So we kind of had this consortium of partners, but actually the problem with Active Bradford as it stood at the time was it was a very new company, and it didn't have kind of the governance structures to hold such a large amount of money. So we were looking for a partner to kind of take the lead to host the program essentially. And at Bradford Teaching Hospitals, we've got Bradford Institute of Health Research, and Bradford Institute for Health Research has Born in Bradford. And because our bid was focused on children and young people, it felt kind of right to host the work here. But like Jan says, there was this. So we hosted the implementation team at the research unit, and we can come on to this, but I think it's kind of really interesting because as researchers and practitioners, you know, we come from very different angles. Like we've got a lot of, as a researcher, a lot of sort of in-depth knowledge about physical activity, you know, very much kind of from scientific literature. So we had these kind of set ideas about, like, you know, if someone gives you 11 million pounds, what are you going to do? And it's like, oh, like we do this and we do this and we do this. So you get to kind of have all of these ideas. But then it's like, but we're researchers, so we have no idea about how to actually do this. So there was like, okay, we've got all these ideas. Over to you, Jan.
Yeah, I came in and it was a real hit the ground running moment because we were slightly delayed. So it was a lot of pressure just to get started. The team were 3 community engagement managers. They came from backgrounds like youth work and community development. A really great, very diverse team, very reflective of the community, South Asian community, predominantly in our area, and therefore, you know, we had this fantastic team. But they were all completely new to research. So there was all this language that they were hearing, all this terminology and academic language that was like really new to them. So it was like 2 kind of worlds that were then sat literally in the same building together alongside each other. So we built the original plan. We actually had to hit the ground running with our plans almost immediately. So, but luckily there was all this evidence and all this insight with over 1,000 families that had been talked to. So there's a lot of good stuff to build on. And I'd had experience in actually just delivering the doing around similar things. That's kind of, but it was the first time really that one in Bradford had ever done anything on this scale in terms of having an implementation and a research team alongside each other. And it was certainly the first time I'd ever been in that situation. And I really didn't know if it would work, but I think, without a spoiler alert, but I think it worked really, really well. It's actually, yeah.
Just to clarify that, the reason why you had a research team and implementation team together was actually because of a governance issue. It wasn't, so it was almost by kind of chance that this happened.
Yeah.
It was, and at the same time, there was another big project going on in Bradford, where there was this kind of interplay between research and implementation.
Yeah.
And one of the things that I'd kind of noticed sitting in the research world was that there was quite a disconnect between the research and the implementation. So I was kind of thinking at the same, as very fortunately, we sort of had this scenario where we kind of were forced to do it. But at the same time, I was thinking it would be great to test it out and see if we can break down some of those barriers between research and implementation. So just having kind of observed how things were working elsewhere.
And I think also Born in Bradford is just so innovative. It's so flexible. It's so prepared to take risk. And I think a lot of research institutes would have probably maybe not jumped in with quite that sense of can do that I think is sort of testimony to Born in Bradford actually as well.
Yeah. I've experienced that too. Yeah. It feels like that sort of place, you can try things, you can be reflexive, go outside the box a little bit, Okay, so what did you actually end up doing together, and how did it go?
Well, so we basically from the basis of all that evidence, all that sort of insight and sort of the experience in the doing side that myself and the team, the implementation team brought to it, we actually came up with 15 work streams. 16 actually, 16, one got added on at the end. And those 16 work streams were then implemented over a 5-year period. And actually, so we were reaching 30,000 children across this very diverse and disadvantaged area. And this involved working with lots of different organizations. So we were working with schools, with our mosques and madrasas, with voluntary sector organizations. We had a whole system approach within schools called Creating Active Schools, which was really, really effective. And we'll come on to the fact that we've got fantastic evidence coming out the other end now. On that, but also we developed green spaces. So we built new parks. We built 9 new green space developments in the space of 5 years. It was like a 5-year sprint, more or less, because we did have a lot of resource and not very much time. And we had a controlled trial that we were sort of running. We needed to know that by a certain date we were on all kind of at our maximum of activity. So we did a lot of training local people to be local leaders. We worked to reach out to families through social marketing interventions and communications. And we had jump connectors and community engagement managers were our kind of people who were linking up the system. They were the kind of mechanics that was kind of connecting up all these 15 work streams. But our main focus was on this neighbourhood approach. So we worked at a hyper-local level, bringing together around 20 or 30 partners, co-designing local action plans really closely with them. And we had 8 of those neighbourhoods across our patch. Then we also did some strategic work, getting physical activity embedded in policy, working with our partners in the council and Living Well. So yeah, it was like a sort of 3-ring circus, where they have all the plates spinning at once. It was that kind of thing. But the research was super important to what we were doing. So I'll hand over to Sally to say a bit more about that as well.
Well, you're just going back a step though, because when you're talking, Jan, it takes me back to those kind of initial stages when we were writing the bids back in 2016. And I remember writing things in the bids, like the neighborhood action group. So kind of had this idea of, how do we create change at a local level, and what partners do we need to be involved? So I clearly remember what the diagram looked like that I put into this bid, which was we need the schools, we need the community organizations, we need the police, we need neighborhood teams, we need all these kind of key players that are going to come together and start working more closely around physical activity in their area. And I put this diagram in the bids, and I remember thinking, I have no idea how to do this. So this is like, just again, kind of like another example of that from sort of an academic perspective, having all these kind of ideas, but not actually knowing how to realize them. And that's kind of one of the things that has been great about working in this partnership way.
Yeah. So, because a lot of what you were saying just then, Jan, there's a very interactive approach is going on there.
Yeah.
And Sally, it sounds like did some of that came from the practice side, that came from because I guess it's not just, you weren't just looking at the literature and deciding what to do. In fact, I mean, it's a common, I think it's a lot of people agree that one of the kind of I guess areas of research, but particularly implementation research, that needs to grow is the practical side. It's focused a lot on theory over the last 20 years. It's developed hundreds of frameworks, but how to actually bring about transformational change, it can't really answer that. And it sounds like by working so closely with an implementation team, they give you some of these ideas of how to do an actual whole systems approach, because it clearly was whole system. You're talking about from people out in the community right up to policy level. But did they give you the sort of ideas then?
Yeah, and I think because it's so big, because we're working across these 16 different work streams, there are some of those work streams that are a lot more kind of like grounded in evidence and theory, and have taken a more traditional approach, a more traditional research approach to their development. So the Creating Active Schools framework is one of those. The Healthy Madrasas work is one of those. The work around our Young Leaders program is one of those. So they've kind of taken this much more, I guess, kind of like in-depth from an academic approach to their development. But we had so much to do. We had these like 16 different work streams. You can't do that development at that kind of in that same way across 16 different work streams in a 6-year period. It's just impossible. So then it was about bringing the sort of doing some kind of like almost like quick academic like reviews to be able to inform the ideas that the implementation team were having. So then there's this kind of like very much research, implementation plus community. One of our other kind of key aspects for the work that we were doing was this kind of like community engagement every step of the way. So I think the green spaces work, where we've developed up these kind of 9 different green spaces, there was a really kind of good example of, okay, what's in the academic literature, what is the experience of the community implementation team, and then actually what do local people want and what do they need, and doing it in a much more kind of like quick, agile way, rather than the years that it takes to systematically develop an intervention. And that's when we see those kind of quick changes.
And that iterative thing is really one of the most fantastic things about it, I think, was so we had a process learning kind of side to our research, which was, and we had various levels of research. So the control trial was kind of our absolute gold standard that was running also, but then we had the whole piece of process evaluation, which was a big focus for Sport England. So they really wanted that as well. And what it meant was that we would have our researchers in amongst our sort of team meetings with us, talking about what was going on, and they would feed back what was coming out of the research, and that would live in real time inform what we were doing next, and we would change our plans, according to the feedback that was coming back through the process evaluation. So it was constantly iterative, it was constantly test and learn, and I think that was to me a whole level of innovation I haven't experienced before, where, you know, you're working alongside each other with that sort of level of closeness, that it's really improving practices as we go. So, for example, the local action groups that came together were really key to the systems working, because they involved, you know, all of the partners coming together, and there was a lot of relationship building, a lot of getting that sort of buy-in, building that enthusiasm. Money helped, you know, having resource to draw people in initially, but actually people got genuinely passionate about physical activity. We did a lot of work to kind of build that motivation and that engagement. But things like whether we met every 6 or 8 weeks, what time of day we met, and like how we structured those, whether they were like focused on the action plan or they were just about sharing and celebrating success. That was really challenging to work out what worked best. And it wasn't one size fits all, but we were trying to come up with something that we could share in terms of the learning about, you know, what was the recipe for success. And that was one of the areas where we made quite a few changes over the period of time, and they were very much informed from what the feedback was coming back through the process evaluation.
I think so I guess to kind of explain, there's 2 things that I want to talk through.
Yeah.
So one of them is kind of to explain the research in a little bit more detail, the plan of research, and then also to kind of mention around the local action groups and how research was kind of embedded into community settings as well. So like Jan says, we kind of had 2 predominant strands of our research. One was very quantitative, our controlled trial, which I can talk about later, and the other was the process evaluation. So again, when we kind of set out on this journey from a research perspective, we didn't, we were, you know, what our experience had been evaluating individual or perhaps multi-component interventions. Like, you know, we didn't have experience in evaluating whole systems approaches at all. So again, it was kind of like, oh, you know, we spent a lot of time scratching our heads and trying to work out, like, how do we do this? And I think, you know, our understanding has improved over these years, and there's still a lot of learning to be done as well. But just with our process evaluation, so with the process evaluation, it operated at 3 levels. So we had the strategic process evaluation, whereby we talked to different sort of sector leaders across the district. So that might be around physical activity or health and wellbeing, or our partners in landscape architecture. So, you know, kind of anybody who might fit into the physical activity whole system. And we also had focus groups with myself and Jan, led by one of our senior research fellows. And so the directors of Jump, we also talked to the other partners about Bradford. So it was kind of about kind of understanding at that system level what's working for who, how, why, and when. And there was kind of like, what's the mechanisms that's underpinning change? That's kind of what we were doing at kind of this strategic, more kind of like system level. Then we went down to the neighborhood level. So the neighborhood partners were all of those people involved in those local action groups, and particularly looking at the different 16 work streams. So what was working for who, how, why, when, mechanisms underpinning that, the changes that we were seeing across those different 16 work streams and across those neighborhoods partners as well. So, you know, how's the system working at a neighborhood level? And then we looked at children and families. So understanding children and families' experiences of taking part in Jump. And like Jan said, the kind of like the beauty of this way of working between research and implementation was we wanted, from a research perspective, to kind of work through the data to understand it in kind of depth and for that sort of more academic understanding. But actually what we could do was just, like Jan said, sort of immediately take it back to our implementation team and say, hey, this is, you know, this finding's coming out. This is really interesting. This isn't working. You know, what can we do to change that? And then we'd all together, our research and our implementation team, would have a meeting where we dig into something particularly and say, okay, what can we do differently? What might work? What might not work? And then that can kind of go back into the program delivery. So that's kind of the way that process evaluation worked.
And one of the things that, just to mention while we're on that subject, that was really interesting was ripple effect mapping. So that was a tool that we used for research purposes. But what we discovered as we were using it was that our local action groups really loved doing the ripple mapping, and they found it really motivating. And it was like such a fantastically visual way of them understanding how system working works. Does you see those unintended consequences? Oh yeah, actually, because you did the cycling there, this lady locally, she set up her own cycling group, and now that's just running, and they would explore it. So actually, it became an implementation tool as well as it was working for both. Yeah.
So the methods you used facilitated the kind of interaction between everyone in the system, the researchers, the practitioners. It sounds like it was like a learning system, and it wasn't a canned approach. You really were connecting research and practice, because you had an approach and you would start doing it, and then when the challenge would come up, or you'd learn something new from the literature, or any new information came to light, you would take that to the implementation team and ask them what they thought, and then you would adapt and respond accordingly. So it sounds like a beautiful setup. And also, you're in the same room, right? So when you'd have those meetings, it would be face to face as well.
Yeah, absolutely. Yeah.
It sounds like a very good situation.
Yeah, and also that those kind of, being in the same room allows some of those more kind of like organic conversations to happen as well. So it wasn't like we would just be like, we're going to wait until Wednesday at 2:00 to talk about this. If there was kind of something coming up, there would also be those sort of more organic conversations.
And I remember at the really very beginning, we were a bit worried about that whole, whether there would be bias, like that whole issue. If we were working that closely together, what would that actually, the research wouldn't be, kind of robust enough. And I do want to say a bit about that, because I think we come through that to feeling very positive about the choice, but there's some
I
things
think
to consider.
I think it's interesting that when we look at the quantitative versus the qualitative data, because when we're doing that kind of like qualitative data, I think as researchers, regardless of what our kind of methodologies are, like I consider us to be part of the system, actually. So we're not kind of like sat outside observing the system. I think, like knowing how important the data is, be that quantitative or qualitative, it is part of the system. I don't think we can deny that if we, it's part of the system, and it's a really important tool.
Yeah.
So
yeah, just very brief comment, because I know why you talk so much. I've thought about this, because it's like the outcomes you decide to focus on, the methods you decide to use, like the ripple effect mapping, for example, will affect the system.
Yeah.
If you'd done an RCT instead, a traditional RCT instead of ripple effect, well, I know it's kind of, instead of like ripple effect mapping, or that would have been very different for the system, right? So yeah, I think we are very much part of the system in this case anyway.
Yeah. And I think so that from a qualitative perspective, understanding that and kind of acknowledging that from, the outset, it's like, like we are part of the system. We can be, we can feed into the system. And in a sense, as researchers, it gives us somewhat more kind of objectivity when we're not delivering the kind of the on the ground work, to be able to look at what's working, what's not working. And I think the other thing is there's just so much to talk about. The other thing to think about is this kind of, like change in mindset of everybody around understanding what's not working is as important, perhaps more important than what is working. So kind of like we can come on to it, but we definitely had to sort of think about changing people's ideas and ways of thinking to be able to kind of acknowledge, right, well, this isn't working. And then the next step is, what are we going to do about it? Rather than this isn't working, end of, funding will be withdrawn, and that's the end of it. And there are some things that, that clearly we tweaked and we tried and they didn't work. And then you've got to get to a point where it's like, right, that, this isn't working and therefore we're stopping. But most of the time it's not working, and you can change things around that. And you can influence like external factors so that it does work.
Yeah, and we worked on a real culture shift within the commissioning, because we were very lucky at Sport England. Were really wanting to innovate. They wanted to test and learn. So we commissioned, I think, over 60 different organizations at different times. So there was a lot of money went out through commissioning other partners. This is so critical to systems working, that you have all the partners involved. But we really wanted people to see this as a test and learn. So our requirements were kept to a fair minimum. And we really wanted to encourage them to feedback what wasn't working or what the challenges were, as well as what was working. And that was quite a culture shift, because, for instance, the marketing company we worked with, their tendency was to want to sell all the positives, because they're in a commercial kind of marketing world. Getting them to actually say, no, but we want to know what didn't work, and we want to know what we want to explore with you. And they made that shift, and it was really interesting. A lot of our organizations were really kind of won over by this sort of test and learn approach. And actually we've sort of fed that back up through the system to Sport England, who are now taking this whole system, physical activity, what they call place-based expansion work, out to 80 new areas. They're investing £250 million nationally in the next 4 years. So this is a huge piece of work to tackle inactivity that's going on, and they have built in to the kind of future vision, this test and learn idea, to say that actually we're interested in what isn't working. We're on a sharing learning journey, and this is such a big shift from a major sort of government organization to move away from, right, we've got KPIs, we want to see you perform against these KPIs, and you're either doing it or you're not doing it. It feels very very kind of positive in terms of and also I think they're building in evaluation that really tries to be more iterative and encouraging people to look at how they evaluate in more sort of kind of flexible ways.
Mm-hmm. So I was just going to talk a bit about the control trial as well. What we ended up with was a controlled before and after design. So we recruited schools. So schools were kind of our platform for collecting the data from the children. And we recruited schools within 3 of our jump neighborhoods. There were 8 jump neighborhoods in total, but we focused on 3 at this particular time point for running the control trial. And we then looked outside of the jump area, predominantly outside of Bradford, actually, to recruit matched schools for our control group. And we collected data at baseline, and we collected data at 24 months, and we're just at the phase now where we've collecting data at 36 months, which is the final endpoint of the trial. What we're doing with the quantitative data now is absolutely feeding that back into the system. So it's like, okay, what changes have we seen? What's the direction effect with things? Things like, how effective has the intervention been for different groups? So we're able to do some exploratory analysis. And what we found is that the intervention is more effective for our South Asian population and more effective for boys than girls. So we can use that data to say, okay, we're tackling inequalities for our South Asian families, but there's still this kind of work that needs to be done between narrowing that gender gap in physical activity. So what are we going to do with that? So we can, rather than just kind of the control trial data being that observation of what's happening, it's then about taking it into the system to then be able to kind of, again, address some of those issues that are coming out. Like what do we need to change about what we're doing so that girls are better supported within the system? So yeah, it's not, I think it has to be considered as part of the system.
Yeah, and in the long term, it will also provide that iterative. It's a slower process because obviously we've just got the data.
Yes.
We're now moving in. It was after the 5 years of the local delivery pilot phase, where we were the only effectiveness study that Sport England funded. So there was a lot of pressure on us about, right, well, we're counting on Bradford to get positive results, which, basically we have, which will be published soon. Now we're into this deepening phase, this next sort of 3 or 4 years. I think the findings from the control trial will really start to be able to be influencing practice. So we know, for example, because it's with accelerometry, you can see what time of day a child was active. We now know that the schoolwork was effective. but also fantastically, we've actually changed beyond school. We have changed children's physical activity levels on weekends, which was, the bit that I personally was much less sure about, because you've got less control, and we're talking about families who are very disadvantaged with a lot of pressures, a lot of struggle actually in the last 5 years. A pandemic, cost of living crisis, which all of those things hit our communities harder than most people, and yet still they have responded to all of this messaging and all of this new parks and all this experience to become more active, particularly to reduce their sedentariness, and just light up physical activity increases. So that is very encouraging, and it will mean that we can really make a case to say it's not just about schools. Actually, parents have a responsibility to get their kids active and to encourage them to be active, and we can actually, even in our most hard to reach communities, we can make those changes. We can, but parents care that their kids are happy and healthy, and if you get it right and make it low cost, no cost, simple to do, you can actually affect change in people's day-to-day lives beyond school.
Wow. There's so many sort of parts to this. And I wonder how far you feel, because it's clearly you've shown it's possible to make a difference. And you've drawn from very robust scientific discipline and skill and experience. I've also connected with people in the community and on the ground, that there was a degree of, with this test and learn approach, like psychological safety, you might argue, that people weren't afraid to say if something was going wrong. It was okay to do that, and you could respond to it. And all the methods and everything's very interactive. Do you think this can be repeated somewhere else? And if it is, would it need you two to be involved? Perhaps that's not the right question, but I guess you two, obviously you've developed relationships, you've built trust, you've built up some great results. Can we repeat this elsewhere? What would that need?
Yeah, I think that's a really good question. I think the first thing to acknowledge is we had a good budget. We had political buy-in. We had a good budget from Sport England, so that's kind of like national buy-in. There was local buy-in. I think we kind of need to think about what, like, the conditions for change, like what are the conditions that are needed, and I think those things are absolutely key. There's no way that we could have done this without the budget we have. It's kind of like the first thing. But we are looking now at, obviously these opportunities don't come around very often, so it's now about, okay, well, what can we do to sustain the work in Bradford at a lower cost, is one of the things that we're looking at. But then secondly, can it be repeated in other places? I think absolutely. It's about the model that we've used rather than like what we've done kind of on the grounds. And I think if you take the model of what we've done and how we've done it, and take that to another place and say, okay, we'll work with you. This is what we did. Who have you got? What are your assets? Who are the people you can draw on? How do we, how can we link you in? How can you be better linked into academic partners? Or thinking about what are the kind of methods that can be used that are easier to do, and perhaps, what am I trying to say? I think so. Actually, what we're doing in the next phase is probably moving towards understanding how this could be repeated in other places, because in the next phase we've got less budget as well. So we've got a significantly less research budget, for example, a hugely less research budget. So now we're looking at methodologies that we can do in Bradford, testing out new methodologies, particularly moving towards more of a drawing a more kind of like community resource to support research and upskill community practitioners in ways of conducting research for themselves. That I think then if we find success in that, that's something from a research perspective that could absolutely be taken into other places. But I guess going back to the point that I originally made, which is about the model of what we've done, not who's in that model. There is something about who's in the model, but I think probably it's about identifying who those people, who are those key people in a place. What do you think, Jag?
Yeah, I think we will. So this is a really fantastic opportunity actually around understanding about implementation science and replication and rolling out models and sharing good practice, because Sport England in effect kind of all more or less creating that environment. So there's 80 new places, all with a budget that's actually not, it's not to be sniffed at. It's a reasonable budget. Our budget was probably more like what you would hope, what you probably see in Northern Europe, in Scandinavia, is just the norm. In this country, for preventative work, it was a good budget. They're back to a more sort of, like British standard of kind of investment of, a couple of million per area, which is still, actually very, very much more than I had when I worked on child obesity whole systems work, and we made a difference with that. So, money isn't everything. It's very important to have some to bring to the table, but we could probably have done this with less if we'd had to. The other thing is we've got a whole load of assets that we can share. That would mean that people don't need to invest again. They can draw on all sorts of things that have come out of our program to sort of not have to start from scratch. So we're hoping to share assets that are useful. But I think the approach is like super important, that sharing the approach. So, things like that very collaborative, solution focused approach, having equity really at the heart of what you're doing. So like growing local leaders from their community, engaging with people who reflect their community. There's a lot of learning, and that is quite well embedded with Sport England's overall kind of criteria for these place-based expansion. So they're very bought in to the ethos, the values, the approach, moving away from sort of top down and parachuting people into neighbourhoods, moving much more towards real deep insight with people of greatest need, to actually support them, to actually get to kind of, do what works for them. So there's a lot of real positives that I think are happening at that big macro level across Sport England in the way they're working. So, I mean, obviously my knowledge mobilization lead, I am going to be super excited to see what we can do with a specific area where there's like interest to actually really dig into what Jump has done and kind of share it, and see how the context, the local context, kind of fits within what's useful for them to draw on. So, it definitely isn't about an absolute, like, this is like a recipe, following it. That's the thing. It can't be. And yet at the same time, there's definitely stuff that can, that can be eradicated and scared and shared up, as long as it's done within a way that is flexible, and place sensitive.
Yeah, I mean, I think on a very small scale. So we've worked in 8 different neighbourhoods across the north of Bradford, and we're moving into a further 3 neighbourhoods in this next phase. But each of those neighbourhoods is very unique in the way that it's set up, its population, its assets, its community members, the partners that work there, the environment that's within those places. So on kind of a small Bradford scale, we have replicated this in these different neighbourhoods. And yeah, I think it's like you say, it's about taking kind of like the principles of the work and fitting them into another place, and for that place to kind of take on the ownership of it and see what fits for them.
And what I'm seeing at the moment is areas that are doing whole systems, place-based working, coming in and saying, oh, actually, I'm really interested in your children and families training kind of some sessions, because we don't have that and we feel it's a gap. And so there's, and I know down in Bristol there's work going on with the Healthy Madrasa work where they really are like, so that's saying, oh, this is something we don't have, which we'd really like. So I think some of it will be people almost kind of drawing on specific elements, but because there is this kind of wider, I mean, we would be really worried if people were just picking one thing and saying, oh, we're just going to do that, because that's where this whole journey started with, if you think right back to the Daily Mile. So if you go back to sort of, I don't know, 10 years ago, there was this idea that we can do one thing that will get kids active. And there was a project called the Daily Mile, which was getting children to run a mile in school, or run every day. And it was this very specific, very kind of quite narrow intervention, and it had all the traction briefly. And it still runs. It still runs. It's still out there, and there's nothing wrong with it. As part of wider. But the idea was that it was the panacea. It was the one thing that was going to change things. And actually, I don't think we're in that place anymore.
No,
I think, and nobody's expecting that, but I would be very much challenging an area that came to us and said, actually, we really just want only to do, X. We just want to do your social marketing. We're just going to put some messages out and that will change behavior. I'd be saying, no, actually, that I don't recommend that. That's probably not going to work for you. Yeah.
So, okay, because we're getting nearer the end now, because I don't want to keep you guys too. I know you've got a big place, but I had a guy on yesterday, professor called Harvey Mailer, right? He's a systems guy, and he's saying that a lot of the time, the reason why things don't get achieved in systems is actually because of the system, right? And usually it's about 80% of the time it's something that we can actually change. People might not think we can, but you can. And so I just wonder if what you've actually done is you've kind of worked with a huge system, but what you've actually managed to do is through the approaches you've taken, the way you've thought about this is remove constraints in the system. So, of course, you have the funding. I think there's these outer setting factors that Laura Dam showed it. She developed the CIFA framework. She referred to them as kiss of death variables. So if they're not there, it'll die. So you're right. You've got your funding, politically favourable, but structurally it was complex because it was so big and long, and structurally, socio-politically, sounds like everyone was on board with it. So maybe that wasn't too bad. Not many people are going to say, "Oh no, exercise is bad." The emergent complexity, though, as you were saying, every area is different. There were things you couldn't predict. That is very challenging. And what, perhaps by your approach, what you actually have done here is find a way to overcome constraints, but also overcome complexities by just getting everyone to kind of solve it together. Do you think that's perhaps, I'm just thinking out loud, but maybe that's the kind of theory about this. I don't know.
I think that's a really interesting thought. And it reminds me of an example. So, it's this conversation I had. So basically, we've worked really well. We've worked really closely with our madrasas. So it's one of the first time so madrasas, for people that don't know, are schools, like they're Islamic schools that children go to most nights of the week after school for 2 hours. So in Bradford, most of our children, about 90% of our children of Muslim faith, will go to madrasa for a couple of hours every night after school. So it's kind of it's been very much missing from the health system, this great way of accessing and working with children and families through these settings. And actually, really interestingly, Islamic faith promotes health messaging. So it's kind of, so we've drawn on this as a setting, but not only have we delivered, work within those settings, one of the key things, as Jan said earlier, is about connecting the system up. So some of our madrasas don't have space, don't have kind of like the facilities to be active. So through kind of those mechanisms, there's like system connector mechanisms, like our community engagement managers or our jump connectors. There are local people who work to connect the system. We've connected those to community organizations. So then there's this relationship then between the community organization and the madrasa. And then there's a green space. So the madrasa can then use the community organization, community center, to promote physical activity for their children and put on extracurricular physical activity sessions. Great. But then there's this green space. And those two organizations have worked with other partners on developing up and improving this green space. So these two organizations, the madrasas and community organizations, sat next to each other for years, never talked to each other, never used this green space because it was underdeveloped. Then the green space was developed and both of those partners fed into that. Then one day they notice the grass is growing too long and the kids aren't using it because the grass is too long. So they talk to each other. They say, yeah, you know what we could do with a lawnmower. And the madrasa is like, we haven't got any space to keep a lawnmower. So anyway, they put some money together. The lawnmower is based at the community center and they take it in turns to mow the grass. So now they've got this relationship. They've got this green space that like the kids can use because they're both working together to mow the lawn. And it's really, it's those things that are the very kind of like simple granular level that don't happen when you don't connect the system up. So
that's where the community engagement manager role has been so key. And with Jump Connect is these connecting roles that are facilitating and helping to build the links. Without those, if we just commissioned people and the local actions, there are a number of mechanisms that are about connectivity. Do you know what though? I just had a thought, Kristian, because when you're talking about replication and scalability, do you know what? It is true that in a level we kind of did this within Jump, because in the first 2 years we worked with 3 neighbourhoods in what we called our pioneer neighbourhoods, where we tested and learned this approach. And we had those same 16 work streams, and we were very much testing the model. We learned off the back of that, and then we rolled out to 5 new neighbourhoods. And within those 5 neighbourhoods, they were very different, and each of them had very different conditions, but they were kind of also sort of almost little mini worlds, little mini, kind of interventions in themselves. And actually, the model held up, didn't it, across that? And the community engagement managers have the understanding of the model that they can flex it according to their areas. And so in replicating and scaling up, it may be that the main thing is to look at what are the key components that allow that contextual change, that flexibility. So the training of those community engagement managers to have the right headspace, the bringing together of the local action plans. So one of the things we will definitely be sharing, learning on, is the process, we had a 3 workshop process by which we gained a shared sort of understanding, and we built relationships, and we got that buy-in to a local action plan, and it was very owned, it was very co-designed, all of that stuff. And I had evidence. That's I was coming out. So yeah, so we did. That's so true.
We supported the local action groups to learn how to do kind of like quick evidence reviews, and take that evidence reviews and not necessarily make the decisions based on the evidence, but consider the evidence in their decision making.
Yeah. And that was a big mindset change for those local partners like ward office and voluntary sector. They were like, yeah, we want to know what the evidence is before we decide to do something, because they'd seen that process of feeding evidence into their own decision making. So yeah, to me, those are the bits that it's the training around, it's the sharing of the workshop model, the sharing, the training of the community engagement managers, the Jump connectors. Because if you get those right, then you're embedding the approach and the principles. And then whether they have 16 work streams or 6, actually, do you know what I mean? That bit is
yes.
I think working across the sort of individual, community, organisation, environment, policy to work whole systems, thinking the socio-ecological model still for me holds as a really tangible, practical and sort of theoretically sound kind of model to work from. So I wouldn't, that still feels like something which we always shared at the local action group, so that everyone had a shared understanding. Yeah, I think it is. So yeah, I think over the next few years, that will be the task, will be really learning. And maybe we need to think about how we capture, from an evaluation perspective, this journey around implementing the implementation science, and anything you can help us with there, Kristian, and to think about how we might do that on a shoestring with the 50p. That'd be really useful.
I really enjoy exploring these ideas. Spread, scale up, sustainability is really hard to do. I don't think we in the literature really can say how to do it. I think a lot of people are still working that out, but there's something in what you've done has achieved that. When you were speaking, I don't know a lot about it, but there is some work around called systems systems conveners are a thing by the Wengers write about this, and I just wonder if that's also maybe something that you were in this case. And with the lawnmower example, that's convening the system. You've connected some people up, and also just all the outcomes that you could never have predicted. Of course, I'll put a link to ripple effect mapping, because I think that does capture sort of what, a lot of things that you might miss in a normal evaluation. So yeah, is anything else you want to add on that?
I was just going to add, if people watching this podcast are interested in knowing more, then feel free to contact me, but also on the Yorkshire and Humber ARC website, sort of by the end of March, we'll have a resource hub up and running around Jump, where you can just dig into areas you're interested in, explore. We'll just basically we'll be trying to open source and share as much of the learning and the assets as we possibly can from the program. So yeah, thank you.
Yeah, and I think we're really keen on having had the success that we have in Bradford, we are really keen on, being able to support other people to learn, and also very, welcoming of other people's ideas too. So, anybody who is interested and wants to connect, please do.
Yeah, absolutely. There's two ways possible to share learning. We want to continue to learn from other areas, and that is just as important as sharing out what we're doing. So yeah.
And getting what you've learned into the literature too, isn't it? It's putting, what you've learned, that both directions. Yeah, absolutely. Thanks both for coming on the podcast. It's been really insightful. We hope to hear from you again sometime.
Thank you. Thanks so much for having us, Kristian. Thank you.